I'm Jan Compton, Chief Patient Safety Officer for Baylor Scott & White Health. I'm honored to be here today to share our high-risk surgery initiative commitment. Baylor Scott & White Health's vision is to be the most trusted name in giving and receiving safe, quality, and compassionate care. Over a decade ago, a transcript was published in the New England Journal of Medicine, as well as some other publications about the high-risk surgery, about the mortality for high-risk surgeries in low-volume hospitals. Our clinical leadership committee at Baylor Scott & White Health asked that a committee gather and start looking at this. That was to be the focus. So there's a group of the high-risk committee and then a subgroup that looked at 11 high-risk procedures. We were engaged with a clinical staff, administrative leaders, as well as surgeon leaders for each of these procedures. The evidence-based recommendations for these procedures included requirements for our program elements. We also looked at resources as well as our hospital volumes. So it wasn't just hospital volumes, which we'd read about, is what program elements, was it the lab, was it radiology, was it intensivist, what other elements needed to be included in the hospitals besides the volume. So through this commitment to the Patient Safety Movement Foundation, Baylor Scott & White Health estimates that we'll save 18 lives annually. This is with the first 11 procedures. We have phase 2, which will be some additional high-risk procedures. So 18 lives saved annually when we're fully implemented in 2018. And thank y'all.